Hello, this is Dr. Gay from First Look MRI, and this is a 41-year-old female who complained of knee pain. She went to her orthopedic surgeon and said that she had had trauma a couple months earlier. Nothing dramatic, but the knee pain never went away after the trauma, and she came in to get an MRI scan, and we see this. So this is a case where the patient has prominent abnormal signal in her medial femoral condyle, well-defined lobulated margins, and this is a classic example of avascular necrosis or osteonecrosis, and this is thought to be due to a poor blood supply. The blood vessels feeding this area are limited and the bone dies, osteonecrosis, and this can be devastating. Sometimes the bone will collapse and they'll have to have a knee replacement. Sometimes if you catch it early enough, the doctor can do a cord decompression where they'll drill a channel in there and let the blood ooze in there and establish a new blood supply, and maybe decompress if it's under abnormal pressure, and patients can go on to heal. But this is, again, a prominent case of osteonecrosis or avascular necrosis in this 41-year-old. Now this can be from trauma. She said she had prior trauma, but usually the trauma is really severe, like a fracture or dislocation or something that would tear a blood vessel. She did not have that. But one of the classic things is corticosteroids. People who are on high dose or long-term steroids can cause avascular necrosis. They can develop avascular necrosis. They think it causes too much pressure within the bone, and that high pressure will restrict the blood supply, causing loss of the blood and AVN. People who drink excessively, high alcohol consumption, they are prone to avascular necrosis. Some blood disorders or diseases like sickle cell anemia or hemophilia or SLE, people who have radiation therapy or chemotherapy who have damage to the blood vessels can get this as well. So this is something that we see, and oftentimes we don't know what it is unless they are on high dose steroids or are alcoholics. But this is a case of avascular necrosis, very characteristic look of a lobulated, well-defined band of abnormal signal. And again, they may get a cord decompression to try to heal this before this weak bone collapses. And that's it. Thank you so much.